Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. 20, 21, 22. Another 72 hours before you're going to become the toppers. Time to consolidate our preparation, reinforce our energy, and reawaken to sprint ourselves to becoming the toppers. So today had been a very hectic day in the hospital, so I could not get time in the morning. So PYQs, always start your preparation with PYQs and end your, whether it is INICET or FMG or NEETPG or USMLE, any exam. So totally 10,000 PYQs are being created in the form of 10 sprint ebook PDFs and made available on the learnergraph.com. So I hope you're all preparing Kushi. Samir Siddiqui, reaware, reset. Very good. So can you please punch Nidhi and everybody? Is the voice loud and clear for all of you? Good. Now, so once you download the Sprint ebook PDF, you get the topic list. These are all the PYQs in the 2015 NEETPG exam. And once every MCQ is converted into a single liner, and we have assigned the topic from which it has come so that you have an awareness of what topics examiner is focusing so that you can focus on those topics. Can the online students can punch? Is the font size is okay for all of you? You can go to the learnograph.com and download the Sprint 11. Okay, good to see almost 25, a quarter century of students. Now, renal pelvis carcinoma. So how do you treat carcinoma of the renal pelvis less than 4 centimeters without metastasis? We treat with partial nephrectomy. Once more, examiner के क्वेश्चन बैंक में बैठा हुआ है क्या renal cell carcinoma as a topic. What is the investigation of choice for dysphagia? So always whenever there is any dysphagia, you need to be sure whether it is for only solids or both solids and liquids equally. So whenever the problem is due to the neuromuscular transmission in peristalsis, then it is equal for both solid and liquid, like in echalasia, diffuse esophageal spasm. But if it is more for the solids, less for the liquids, means it is obstruction. Whatever it is, we do the endoscopy. Now, what is the trigger for Raynaud's phenomena, doctor? Exposure to cold. What are the contraindications for liver biopsy? Thrombocytopenia, hemangioma, ascites is what you should remember. The most common site of lymphomas in the gut is the small bowel. Spontaneous rupture site, whenever there's a Boyer-Harvey syndrome, spontaneous rupture is there. The most common site is in the esophagus above the diaphragmatic aperture. How do you treat desmoid tumors? So these are all the PYQs of NEETPG 2015. But there will be a lot of repetition of the topics you have to be very, very aware of. Samir Siddiqui, I got into residency last year itself, sir. These classes helped me a lot in procuring the seat. Kindly follow this. Sir also does keep it available in the playlist. Please, juniors, follow this. Very good. Thank you, Samir, for the kind words. Every teacher will be always enjoy a good compliment. Don't think that teachers are immune from compliments. Teachers are highly vulnerable. The real dividend in the entire opportunity to be a doctor or a teacher is a compliment given by the patient and the student for the good work that we have done. So we wish that the role of the teacher is only to inspire you more than teaching you. Teaching, learning you can do from anywhere, but somebody need to hold your hand, push you, and tell this is the focused content that you need to review. That is the whole role of the teacher. So, doctor, pancreatico-jejunostomy. So, where do you do that? Whenever carcinoma head of the pancreas is there, we do the pancreatico-jejunostomy and colidoco-jejunostomy. The most common breast cancer is a ductal carcinoma, which is of infiltrating type. Whenever the patient who had a modified radical mastectomy is unable to lift the arm above the head, what does it basically indicate? Long thoracic nerve of bell injury leading to the serratus anterior involvement. Most common location of breast cancer is always upper outer quadrant. Upper outer quadrant is what you need to fundamentally remember. So you can go to www.lernograph.com. There you get the PDF of each of these 1000 PYQs in the form of single liners, totally sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. These 10 books is the one which you have to master when you start your preparation and when you are ending your preparation. So you can visit the learnograph.com. Daljinder Singh is saying, hello sir, while dating with the new girlfriends, I'm forgetting the old girlfriends. Is it what you said, Daljinder? Oh, no. Hello sir, while revising, now forgetting the previous topics. Any tips, sir? To forget is the gift of the God, Daljinder. So don't worry, just go with the flow. See, there are many facts which we don't practice, but we prepare for the entrance. I have seen only one Peutz-Jeghers syndrome till now in 30 years of experience as a clinician. But so many times we taught Peutz-Jeghers. So that is the reason we do forget, but 2-3 times अगर आप उसको proactively revise kare to at least until exam you can remember, because we have 1 billion memory cells in the brain. Hardly we use not even 0.001% of them also. So don't worry about it. The more you worry that I will forget, we can't remember. Simple. Upper outer quadrant. So develop some funny ways to remember. Upper outer quadrant is the way to reach to the breast while examination. So upper outer quadrant, the most common location of breast cancer. So what is the tumor marker for bladder cancer? Nuclear matrix protein 22. So whenever you are repairing, you establish the shunt between the corpora cavernosa and the saphenous vein. That's called Grey-Hack shunt. So what are the lymph nodes you need to examine in a case of carcinoma penis? Inguinal lymph nodes is what you need to remember. Whatever, very nice to see a group of 8 students have downloaded the Sprint 11 PDF, which we are discussing right now from the learnograph.com by paying just 300 bucks. So if you know what are the topics, what to focus, that is more than enough to become the winner. You need not be very deep into those topics, doctor. AFP is elevated, HCG is normal, right-sided testicular mass. What is your diagnosis? Testicular mass. Typically, it is seminoma. Refractory hypoxia in a patient of acute pancreatitis. What is the cause? Acute pancreatitis is one of the causes leading to ARDS. In acute respiratory distress syndrome, typically it is type 1 respiratory failure, and initially it is responsive to oxygen therapy. But as it progresses, ARDS progresses, it leads to a lot of tiny shunts, and that lead to V by Q ratio fall down, and that lead to refractory hypoxic state. So bilateral infiltrates on the chest X-ray in a case of acute pancreatitis, refractory hypoxia, think about ARDS. What is the best way to visualize posterior urethra? Voiding cystogram is what you need to remember. How do you treat anal cancer, doctor? East or West, radiotherapy best when it comes to the anus, anal cancer. So you need to know everything about Negro regime, etc., doctor. Most common infantile testicular tumor. See how frequently examiner is asking about testicular cancer. When you are doing PYQs, you will understand and where to focus. Any number of coaching programs you attend, doctor, वो consciousness जो रहता ना, क्या पढ़ना, क्या छोड़ना, किसको रिपीटली रिवीजन करना, क्या आएगा, क्या नहीं आएगा, वो जो डिस्क्रिशन जो है ना डॉक्टर, वो कोई पढ़ाने से नहीं आता, हम पढ़ने से आएगा. कहां पढ़ना? We have to master at least one whitewash लगाना है previous year questions को, PYQs को, very important. Now, best imaging to stage the lower limb sarcoma is MRI. Every NEETPG one question comes on suture material. Don't forget. Least tissue reaction is seen with polyglactin. Once for what are absorbable, not absorbable sutures. Everything you should know. What is duration of suture absorption? For certain absorbable sutures, it is as long as 6 months. Most tissue reaction that you see with the sutures is seen with which material, doctor? Silk is what you need to remember. Malignant tumor, glioblastoma multiforme, is the form of glioma most malignant of all the astrocytomas. Astrocytoma is the other name given to gliomas. Epulis typically arise from the gingiva. So when do you call mild mental retardation IQ 50 to 70? Borderline IQ 70 to 80. Average IQ of a normal child is 90. What is the developmental milestone at 6 months? Watching self in mirror typically is at 6 months. Begin to use the verbs with ing. Ing is at 30 months. Stranger anxiety is at 7 months. Average weight gain of the neonate per day is 25 to 30 grams. Expected weight loss, immediately after the birth, there will be a weight loss in the first week. That will be around 5 to 10% is what you should remember. What is the optimal head circumference at 6 months? It is 35 centimeters, 35 centimeters at birth, and by 6 months 43. So what is Potter's syndrome? Renal anomaly, severe oligohydramnios, flattened nose is called Potter's syndrome. So whenever there is any congenital heart disease, with the closure of the PDA at birth, what will happen? There is lot of pulmonary hypertension which will put the weight on the right ventricle, that will increase the right ventricular activity. What are the most common cause for the early onset sepsis in neonates? E. coli. E. coli is the most common organism. Which drug is used for neonatal resuscitation, doctor? Sodium bicarbonate is the one which is used. How do you manage breath holding spells? Forced expiration. Whenever a neonate has hypoglycemia, typically whenever the mother is having diabetes, the diabetic mother will initially cause hyperglycemia in the newborn, and that hyperglycemia lead to hyperinsulinemia, hyperinsulinemia lead to hypoglycemia. So neonatal hypoglycemia को 10% dextrose देकर treat करते हैं. So whenever there is a 3-month-old indrawing chest, respiratory rate 52, then we call it as severe respiratory distress is what you have to remember. So once more, classification of respiratory distress is a favorite question of the examiner. What is the definition of chronic lung disease in infant? If he need supplemental oxygen at 36 weeks after conception. Which antigen is responsible for erythroblastosis fetalis? D antigen in Rh group. Whenever there is a erythematous blotchy rash in a 3-day-old, there are a lot of findings which are a normal finding in the newborn. It requires no treatment. Whenever there is any lenticular obesity, definitely you need to investigate the newborn. It is something that you cannot leave. So one of the important causes for the lenticular obesity, you need to evaluate everything like galactosemia, rubella, etc., etc. What is the shape of the cecum in newborn? It is conical. Meckel's diverticulum, how does it present? Painless rectal bleeding. How do you manage severe dehydration? Start ringer lactate. Ringer lactate is very close to the physiological pH of the plasma. Ringer lactate. So once more, IV fluids is one of the favorite MCQ in the NEETPG. So what is the initial fluid for the severe dehydration 1-year-old child? 900 ml in the first 6 hours. So today only go back, do a review on acute respiratory infections management and classification, and gastroenteritis dehydration classification and management in Pediatrics, whichever the book you are studying. Hutchinson's triad. There is a interstitial keratitis, vision is not clear. There is a sensory neural deafness, ears are not audible. There are Hutchinson's teeth, you can't open the mouth. Bura nahi dekhna, bura nahi sunna, bura nahi baat karna. That is Gandhiji's 3 monkeys. You should remember in congenital syphilis. What is the best way antenatally if you want to detect hydrocephalus? Ultrasound. From where does medulloblastoma originate? Immature embryonal cells from which it originates. It is a posterior fossa tumor is what you have to basically remember. Humaira is from long time asking, we're gonna have one sprint of images before NEET exam. Humera, there are 50 full-scale grant tests on the learnograph.com. PDFs are available for you to happily download. Every grant test is having 30 to 40 image-based questions, clinical minute-based. So 30 pakadlo, 30 into 50 is 1500 image-based questions are there. I can guarantee you tomorrow's NEETPG exam, whether it is ECG or X-rays or CT scans or MRIs or clinical images or parasitic infection called larvae, all this will be covered in this 1500 images in this 50 full-scale grant tests. So take every opportunity to revise, but still, if I get time, I will definitely conduct one sprint of images before NEET exam, doctor. Since Humera asked it so many times. So doctor, just now, a group of students downloaded this PYQ PDF from the learnograph.com. So take every opportunity to do that. Also, don't forget to like this video, share this video, and write your comments, what all that good compliments you are writing here. Please do write below the video after the broadcast is over. That will help to make the video become viral. So now, doctor, what are the initial presentation when there is a kernicterus, seizure? Whenever there is a lumbar mass, abdominal pain, bone pain, what is your diagnosis in a child? Neuroblastoma. Abdominal mass with fever, bone pain, and IVC thrombus, neuroblastoma. So what is the maintenance fluid required in a 6 kg child? 600 ml per day. What is the common type of total anomalous pulmonary venous circulation? You know what is meant by anomalous pulmonary venous circulation? Normally, left pulmonary vein, right pulmonary vein, all pulmonary veins are expected to drain into the left atrium. Instead, if they form a common pulmonary vein and instead of draining into the left atrium, if they drain into the right atrium, then they are causing mixture of good and bad blood, which is typically called TAPVC. Anomalous pulmonary venous drainage into right atrium instead of left atrium. How can it drain? It can drain directly into left atrium, which is called supracardiac, or it can drain into the IVC and from there it can come, it's called infracardiac. So supracardiac is most common, figure of 8 appearance, otherwise called snowman appearance, is the radiological feature sign par excellence in TAPVC is what you have to basically remember. So now, doctor, how do you confirm Henoch-Conlin's purpura? Henoch-Conlin and IgA nephropathy are the two ends of the same spectrum. So renal biopsy. Why there is an abdominal pain in Henoch-Conlin purpura? Fundamentally, Henoch-Conlin purpura is a vasculitis. So that will involve the mesenteric vessels. Mesenteric vasculitis occur, and that will cause the ischemic necrosis of the mucosa of the GIT, leading to the development of abdominal pain. What is a very early sensitive indicator of depletion of the intravascular volume, doctor? It is the tachycardia. Tachycardia. What is the rate for inotropic support with dopamine for a severely dehydrated child? Around 1 to 5 micrograms per kg per minute. Whether you want to be pediatrician or not, you need to remember this. So how do you diagnose the syphilis in a newborn if the mother is syphilitic? So syphilis capita M test. So what is the condition where you see hoarseness of voice and beaded eyelid papules? It's called lipoid proteinosis. Which supplement decreases the duration and severity of diarrhea? Zinc. That's the reason we do zinc supplementation in diarrheas. So what is the schedule for Japanese encephalitis vaccine? 2 doses, 1 month apart with a booster after 1 to 2 years if required. Autosomal recessive disorders are more common in consanguineous marriages. मौसी का बेटे को मामा का बेटी को शादी करे तो autosomal recessive disorders. Nasal septum contain palatine bone and maxilla is what you should remember. What is the preferred site for aspiration, bone marrow aspiration in neonates? Anteromedial tibia. Don't forget. So what is the ion in ringer lactate? Lactate ion. Periodic phlebotomy. Regularly खून पीना पड़ेगा आप पेशेंट का, खून निकालना पड़ेगा. Phlebotomy is a feature in polycythemia rubra vera. How do you treat Kawasaki, doctor? We give IV immunoglobulins. Kawasaki is also called mucocutaneous lymphadenitis. It is a medium-sized vasculitis is what you need to remember. Strawberry tongue will be there. Involvement of the conjunctiva. And there will be coronary artery aneurysm in a child leading to MI. So, इतना छोटे नन्हे मुन्ने बच्चे में हार्ट अटैक हो गया बोले तो कावासाकी डिसीज, IV immunoglobulin. Puff of smoke appearance on angiography. Where do you see? On fluorescent angiography. Moya disease is what you need to remember. So, Takotsubo cardiomyopathy, Moya disease. All this Japanese terminology you need to be very good with, doctor. Very good. Just now a group of 4 students have downloaded the PDF of the Sprint 11 from the learnograph.com. Very good, doctor. So, a lot of times people have a wrong perception. What is a wrong perception? Even we as the students. कोई बोलेगा मैं हैरिसन पढ़ा, नेल्सन पढ़ा, विलियम्स पढ़ा, सब कुछ शॉ पढ़ा. आप टॉपर बनने के बाद कुछ भी फेंक सकते हो. ये सब अगर पढ़े तो वो आदमी नहीं है, जानवर होगा. He must be a lion, right? Eating the lion with a topper brain. असल में टॉपर बनने के पहले उतना टाइम नहीं मिलता, right? Any topper has the same 2 adrenal glands and 1 brain and 1 heart with a SA node which is pumping at 72 per minute. So what is the secret? How people read very little and still become toppers? So 10,000 PYQs from NEETPG 2012 to 23. Pura 10,000 PYQs in this 12 years. अगर एक मर्तबा आप खत्म करें तो क्या मिलेगा? विजडम मिलेगा. More than what you need to read, you should know what you should not read. You need to read only 10% of the books. 90% you should not read. But how do we know what to not read but only to read? हम सोचते हैं कोई कोचिंग सेंटर में गए तो गुरुजी बोलेगा, तो आप गया कोचिंग सेंटर को, उसने बोला कि लाइक डॉक्टर मुरली भारद्वाज विल से, देखो बेटा ये 300 पेजेस में पूरा भगवत गीता, कुरान, बाइबल सब कुछ है, ये पढ़ लो बस, मस्त है, विभूति ले लो और जाओ, बोल के बोला. देन वन ऑफ आवर फ्रेंड, ए मेरे पास प्लान ये है रे, प्लान डी है रे, प्लान एम है रे. वो लोग ने इतना मोटा बुक दिया रे, उसका कंडेंस्ड वर्जन भी है, उसका भी कंडेंस्ड वर्जन है. अगर उतना मोटा मोटा बुक पढ़े तो कोचिंग का जरूरत क्या है, हम ही पढ़ सकते हैं. हमको उतना पढ़ने का टाइम नहीं है, एबिलिटी नहीं है, एड्रिनल ग्लैंड का अवेलेबिलिटी नहीं है. गर्लफ्रेंड है, बॉयफ्रेंड है, उसको मैनेज करना, नहीं तो 6000 मोटा मोटा बुक को पढ़ना. So always I tell the students in the past 25 years, take the last 10-year PYQs, just whatever knowledge you have, go through answers and questions and finish one round. Right? Once you do that, you know what examiner want. You also know what you don't know, what you need to know first time in life. Good enough, right? Then you finish the preparation. Last moment में और एक मर्तबा PYQs को देख लो, बस एग्जाम को शांति के साथ चलो. So now the question comes. If you take a question with all 4 options, you will be really depressed. After finishing 30-40 questions, you feel so depressed. Oh my God, what is this? I don't know. So many things. Instead, if each PYQ is converted into a single liner and one topic is being assigned, from where is this question coming from? And you have the 10,000 questions available to you every 1 hour. Trust me, 150 PYQs khatam. 70 hours to 80 hours में 10,000 PYQs खत्म. अच्छा 100 घंटे पकड़ लो, कोई बात नहीं. 100 आवर्स में एक ब्रेन वॉश कराओ, कार वॉश के जैसे. 10,000 PYQs को टक 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 रिवाइज करो. देख लो, देख लो. अच्छा वाटर सिंड्रोम है क्या? अच्छा लिडल सिंड्रोम है, मेजनर कर्पस्यूल है, रफनिंग्स कर्पस्यूल है. मैं कभी सुना भी नहीं. इंजीनियरिंग स्टूडेंट को कितना ज्ञान है उतना ही मुझे भी ECG उतना ही मालूम है. One of my student Kaushik used to say, "Sir, don't ask me ECG. I only know as much a BTech student knows." He's at least honest, right? So once you go through the 10,000, even you did not read anything at all in MBBS, still 30% of the PYQs you will know. 70% देख लो. 70% में, that means 7,000 PYQs में 3,000-4,000 PYQs require a little focus. थोड़ा deep जाना पड़ता. Which type of renal tubular acidosis में nephrocalcinosis is a feature. Why the diabetes insipidus is a diuretic condition, but still thiazide diuretic is the treatment of choice in diabetes insipidus. What are the 5 causes for normal anion gap metabolic acidosis? What are the 10 causes for high anion gap metabolic acidosis? ये चीजें ऐसे चीजें हैं जरा डीपली जाना पड़ता, but not more than 3,000-4,000. So master those where you need logic, capture those where you need to have that factual memory, but it will take another 200 घंटे में a self-cleaning program is over. So first 100 hours to go through one PYQ review, then knowing what to read, what to focus, what to remember, what to not read, then drilling those concepts where you are really going bad, another 200 hours. Last में 50 hours. 50 hours is all that you need to do a quick revision of the PYQs once more. Bas 100 plus 200 plus 50, 350 hours से कोई ज्यादा पढ़े तो you will get Alzheimer's disease. Let me tell you, too much material is too bad. You will lose the focus. You can't revise. What you don't revise is not worth reading. That's what you need to basically remember. Saurabh is asking, sir, in FMG, I got 149 by 300. I have not done PYQs yet. Is that a reason to fail? Simple, Saurabh. Always look at the full half of the glass, not empty half of the glass. 149 by 300. आप महापुरुष है. You are already wonderful guy. You know 50% of the game. पता चल गया. So what you do is, after the NEETPG is over, I am going to give 15,000 PYQs that came in FMGE in the past 15 years as single liners with the topics. I'll give it as one sprint book. Just run through them. Suddenly your 140 score will go to 250, 260 out of 300. All right. So that is the reason, always look at the good part, not the bad part. Right? Tomorrow when you become consultant, you have done a surgery. That is, with surgery, are you going to bring back the patient totally? No. Some damage control you have done. Right? After that, you need to reinforce what is that left over. So that's the reason, look at the full half of the glass, not the empty half of the glass. Only if you are such an incurable optimist in life, you will survive to be a medical student or a doctor. So Saurabh, I am telling you, this FMG, you are going to make it. Nothing to dishearten. WhatsApp me. I am always there free for you to help you at any moment for anything. Right, Doc? So let's continue our journey. Doctor, you are with Sprint 11. Please go to the learnograph.com and download this PDF. Now, parathormone. Which cells are activated by parathormone? Osteoblasts. That's the reason teriparatide, which is a synthetic form of parathormone, is being administered continuously to treat the osteoporosis. Osteogenic sarcoma mainly involve metaphysis. So which tumors involve metaphysis, epiphysis, diaphysis? Diaphysis is only two tumors, osteoid osteoma and Ewing sarcoma. Osteoid osteoma, Ewing sarcoma only involve the diaphysis. So once more, bone tumors, doctor, without that there is no NEETPG. Paper out. Now, snapping knee syndrome, it is the pes anserinus which is involved. Pes anserinus is the point, common tendinous point of insertion of quadriceps. Vastus medialis, lateralis, intermedius, rectus, femoris, quadriceps. What is the characteristic feature of the tennis elbow? Tennis elbow is tendinitis at the common extensor origin. What is jersey finger? Flexor digitorum profundus tendon avulsion injury is jersey finger. Wrist drop. It is the radial nerve injury. Extensor and radial deviator of the wrist is the one which is affected. What is the test to confirm a fixed flexion deformity of the hip? It is the Thomas test is what you need to basically remember. Which joint is involved in trigger finger? Metacarpophalangeal joint. So all these things, cauda equina level mein, you need to voice out in the tomorrow's NEETPG exam. No thinking. If you are still not knowing these PYQs, means you are a little far away. Multiple wedge-shaped subchondral depressions. Where do you see? Typically in osteonecrosis, a vascular necrosis of multiple wedge-shaped subchondral depressions are seen. Sudden dorsiflexion of the foot will lead to Tendo Achilles avulsion injury. What classification used for physical injuries, epiphyseal injuries? Salter-Harris classification. Once more, 4 or 5 points you need to know about the Salter-Harris very clearly when you go to the tomorrow's NEETPG exam. Whenever idiopathic scoliosis is there, Schumann's disease, what do we use? Milwaukee brace. एक बार Google images में जाके how Milwaukee brace looks like, please review. Now, immobilization of the humerus fracture is done with hanging cast. Lift-off test assess the strength of subscapularis. Dinner fork deformity is Colles fracture. Locking of the knee. Locking of the knee whenever meniscal injury is there typically occur when there is an internal rotation of the femur with the foot in the ground is the predisposing factor. So whenever a football player, his foot is stuck and suddenly he takes a internal rotation, a turn, that lead to meniscal injury. Common peroneal nerve lead to foot drop. Whenever elderly has a hip fracture, what is the treatment? Hemiarthroplasty. So you should know, depending upon the age group, what are the various treatment modalities of the hip fracture. One of the favorite question. So पहला hip fracture in elderly every time entrance में पूछता है, बोल के अगर आपको समझ में आ गया तो आप hip fracture को भक्ति के साथ रिविजन करोगे. भक्ति बोले तो not डॉक्टर भक्ति, भक्ति with respect and devotion. You will read the topic. That's the reason. Remember, how do we get bhakti when we are preparing for entrance? How do we get focus instead of wasting time on this, that material and here and there? PYQs are the best teacher. PYQs are the best mentor. PYQs are the ones which will make your saw well soon for the tomorrow's exam. Now, fracture with the maximal blood supply compromise is which fracture? Subcapital fracture. Non-union avascular necrosis in the hip fracture is more in subcapital fracture is what you should remember. So इतने सारे क्वेश्चंस आए हैं hip fractures के बारे में, you need to be very sure. Whenever posterior dislocation of the hip, what is it also called? Dashboard injury. Then it is often associated with the head of the femur fracture. Carpal tunnel syndrome can be seen in hypothyroidism, acromegaly, many causes, but idiopathic is most common. Deformity with an extended distal interphalangeal joint is called swan neck deformity. Clubfoot को बोलते हैं equinocavovarus. The fracture with only anterior cortex broken in a child is called green stick fracture. Green stick fracture typically seen in pediatric population. बरे वाह, हम देखते देखते 100 क्वेश्चंस को खत्म कर दिया hardly in about 45 minutes. अगर 15 मिनट्स पेप टॉक के लिए छोड़ दो, हाफ एन आवर में 100 बोले तो 1 घंटे में 200 like a AK-47 rifle. Dun 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 dun. You need to do the revision and don't worry about you will remember, you will not remember or not. Instead of a dream team of teachers, every coaching center will advertise, we have a dream team of teachers like the cricket team. What you need is not dream team of teachers. What you need is dream team of friends with whom you sit and prepare. Ek 5-6 friends रहना. At least one should be good in gynops. At least should not hate gynops. One should be good in medicine. One should be good in pharmacology. Like that, you need not be good in anything. All your goodness is in assembling these all good people together. Form the team. Take the PYQs. 100 hours में PYQs खत्म करो. 200 घंटे में टॉपिक लिस्ट बना के उसको हमला करो. और another 50 hours में you do the quick re-revision of the PYQs. Simple formula that works every year to become the NEETPG topper without wasting money on ये material, वो material, ये coaching, वो coaching, ये live classes, वो crash classes, इसका batti maro sessions. Oh, all is bakwas. What you need is 4 or 5 good friends to sit along with and be mentally prepared to tell your girlfriend or boyfriend, भाई 350 घंटे मुझे छोड़ दो, मैं गवर्नमेंट मेडिकल कॉलेज में एमडी सीट पाके हमारे बच्चे प्राइवेट स्कूल इंग्लिश मीडियम को भिजाएंगे बोल के आपके महबूबा को बोलो. 350 hours, that's all. Don't waste your time to travel far off places, stay in small one-roomed hostels. Look at the crowd of people. If you really want to date, you have very good apps available to date. No need of looking that in going to a crowded coaching center, right? So I'm there with you. Many teachers are there with you, in fact, who spend time to discuss every day to inspire you, right? Today, YouTube is the biggest teacher. Bilateral congenital dysplasia of the hip. This is an image-based question. Examiner expect you to recognize. Genu recurvatum is what you see in Blount's disease. Ponisetti technique is serial application of the CAS. Pediatrics में क्या होता है? Pediatrics में Pediatrics, beriberi, pregnancy, PDA. In all these conditions, there is a very short circulatory time and that lead to development of high output cardiac failure. What is the most common site for pediatrics? Pelvis is the most common site. Perthes disease, it is a vascular necrosis of the femoral head. Onset is before 10. Osteotomy you need to do. Limb shortening is the thing that you see. What is the common site of chondrosarcoma? Pelvis. Onion peel appearance? Ewing sarcoma. Hammer toe deformity? Rheumatoid arthritis. Lunate dislocation may? Median nerve injury. Quickening in pregnancy occurred 18 weeks. So, when I was a kid, I studied in a small village. My grandmother, she studied only up to 5th class. So I used to give her book and say, let us start bhajan. Bhajan means I'll keep recalling question after question and then tell you point after point. तो अच्छा भजन करने के लिए आपको कोई साथी रहना, उसके साथ ऑनियन पील अपीयरेंस कहाँ होता है बोलो, गिविंग सार्कोमा diaphyseal है ना मेरे साथी. So like that you need to do the bhajan in the last moment. That's the only way to remember. Quickening in pregnancy is felt at around 18 weeks. अगर आपको ऐसे न्यूमेरिकल्स 2-3 बार देखे तो ही याद रहेगा, नहीं तो some funny way develop your own method to remember. Another way you can say is after 18 you are eligible to become pregnant legally. So there are quickening कब शुरू होता है? 18 के बाद. 18 is related to pregnancy's quickening and you are quickening to become pregnant. Gestational trophoblastic disease secretes human placental lactogen. At the time of the crowning, what comes out of vulvar outlet? When do you call crowning? Biparietal diameter बाहर निकलने को कहते हैं crowning. Emergency contraception, we use Levonorgestrel. Gestrel. So breech presentation, extended breech, flexed breech, different types of breech. You should know image-based questions come. Similarly, threatened abortion, different types of abortion. What is the management? In which case cervical os is closed, in which case cervical os is open? Favorite question. For the forceps to be applied, what is the prerequisite? Fetus, if it is at the station +2, forceps can be applied. What is the most common type of the breech, doctor? It is frank breech is what you need to remember. Smoking is a risk factor for the gestational hypertension. Once more, सर क्या है ना, ऑब्स्टेटिक्स में 30 क्वेश्चंस जो आता है 30 का 30 मार के निकल सकते हैं आप. कैसे? Gestation trophoblastic tumor. Every entrance exam it is a question. Ovarian cancer, endometrial cancer, cervical cancer. Definitely one question. Trichomoniasis, Gardnerella vaginalis, all these cervicitis infections, PID. Definitely one question. Ectopic pregnancy, definitely one question. Endometriosis, definitely one question. Fibromyoma, definitely one question. Like that, definite. बोले तो मेरे यार 30 out of 30 can be predicted. Nothing will leave. So 30 topics को मरम्मत करने के लिए आपको 30 minutes per each topic into 30 topics is 15 hours is all that you need to read obstetrics. If you are reading more than that, you are not reading at all. Take my word. So, what is the characteristic of sagittal suture in labor? Sagittal suture along the antero-posterior plane of the maternal pelvis. So, what is misoprostol timing after giving mifepristone for MTP after 48 hours? So, what is the best method to induce mid-trimester abortion? Prostaglandin. So, propulsive stage in labor for multipara is for about 20 minutes is what you should remember. So, please don't forget to like this video, share this video, and tell all your friends every day, at least morning. I'll be very busy with the patients, OPD, emergencies, rounds, counseling people about how to control their diabetes, hypertension, how to control their obesity, how to keep themselves fit. Tomorrow, when you become MD General Medicine, don't think you are the first becoming. You'll find 1,000 MD General Medicines around you. Patient को आप इंसुलिन दे या उसको विल्डाग्लिप्टिन दिया, ग्लिफोजेंस दिया, फिर भी patient doesn't stop to order from Swiggy the rice pudding, maida pudding. He will sit before watching the IPL match and keep eating. Next time he will come with HbA1c 12 and he will accuse you. Hey, it's your mistake. My HbA1c not coming down. So, clinical practice, consultant is worst life. Happiest life is अभी जो entrance के लिए prepare हो रहे हैं ना, with 3-4 friends मिलके, going to tea at midnight after watching the second show movie, and then coming to the reading room, then sitting and studying up to 4 o'clock, then 8 o'clock in the OPD, you are running to see the patients. Once more, afternoon you came and then opened the entrance books. This is the best part of life. Okay? So that's the reason, enjoy it, don't cry that I'm forgetting. Until Murali Bharadwaj is there, you won't forget the subject. Let me tell you. Only make it simple with PYQs, 10,000 PYQs, NEETPG based, 15,000 PYQs, FMGE based, 10,000 INI CET based PYQs as all as single liners, topic classified to precipitate to you what is needed. So go to the learnograph.com and download them. Mentovertical diameter is the diameter of presentation, bro. Cardiac output increase. When will it start? By 5 weeks. How much will blood volume increase? 25%. Oxygen consumption increases by 20%. So there is one list of physiological changes in pregnancy. One MCQ definitely will come. You can see NEETPG 2015 में कितने क्वेश्चंस आए हैं, ये सब एग्जामिनर के क्वेश्चन बैंक में बैठे हुए हैं. Abdominal pregnancy, if the placenta is left behind, then infection can occur. Now, what are the incidence of scar rupture after lower segment cesarean section? 2%. Which ovarian tumor lead to torsion, dermoid cyst, complete prolapse, vaginal hysterectomy is done? Mayer-Rokitansky Kuster-Hostner syndrome में होता है Mullerian abnormality. Why do you find testis in that? Symphysial fundal height and fetal weight will be given in tomorrow's exam and asked to calculate the fetal weight. Precocious puberty, where sexual maturity is attained early, you should know what are all the causes, what are the central causes, what are the peripheral causes, everything. Now, what are the contraindication to IUD? Any uterine malformation is a contraindication. So, how do you evaluate the erythroblastosis fetalis risk when the anti-D titers are increasing at 28 weeks gestation? MCA Doppler, the resistivity index will help you. Now, all the components of the Bishop score, you should know. What is the time when implantation occurred? 12 days. Then, how do you know that there is a premature ovarian failure? If there is a premature ovarian failure, there is an increase in the serum FSH levels. If the ovary fails, there is no estrogen. If there is no estrogen, there is nobody to inhibit the FSH. Hence, there is an increase in FSH. What is the marker that ovary ke andar enough anda available? Ovarian reserve marker is inhibin A. The most common site of the genital TB होता है fallopian tubes. Whenever OCP pill is missed, then you need to use backup contraceptive. What is the most common complication of ovarian cyst? Torsion. Now, whenever tubal ectopic pregnancy is there, how do you manage? It all depends on the presence of the fetal cardiac activity. What is the maintenance dose of dexamethasone in preterm labor? 6 milligrams. 666, favorite number you need to remember. What is the very common cause of the uterine inertia that lead to postpartum hemorrhage? It is the retained placenta. How do you manage a complete placenta previa 38 weeks, doctor? Elective cesarean section. Nabothian cyst can be pre-malignant. Whenever the skull suture overlapping is there, you call molding of grade 2. In cervical cancer, what is the most common cause of death? Cervical cancer will spread along the parametrium. It will infiltrate, leading to ureters get obstructed and obstruct to uropathy, leading to uremia, leading to renal failure is the most common cause of the death in cervical cancer. Madam gynecologist hai, Sir is a nephrologist. Ultimately, gynecologist madam ka patient who has cervical cancer will die under the account of the nephrologist Sir. What is the management of CIN3? Colposcopy and LEAP. Once more, doctor. CIN, different grades. How do you manage? How do you approach? Every NEETPG you go, it is a favorite question. What is the size of the Hegar's dilator for cervical incompetence? 8. When you do cervicogram, if there is a funneling, what does it indicate? Cervical incompetence. When do you call cervical incompetence? When the internal os is dilated to 1 centimeter. So what is the risk factor for placenta previa? Battledore placenta. Image based question, come on. One of the types of placenta, all types of placenta, please go back to the Wikipedia or Google Images and try to revise. Now, what is the common site of various congenital malformations? They can be shown omphalophagus. How does it look like? Everything. You need to have a look of that in the images. What is the contraindication for pregnancy? Any pregnant woman who has pulmonary hypertension, ASD, VSD, PDA can have Eisenmenger syndrome with pulmonary hypertension, or there can be primary pulmonary hypertension. Any pulmonary hypertension is a contraindication to pregnancy. When the tear is involving the perineum, external anal sphincter, what do you call? 3rd degree perineal tear. Once more, what is 1st degree? 2nd degree, you need to be ready for the tomorrow's exam. Chorioangioma can lead to oligohydramnios. Chorionic villus sampling is done only in the 2nd trimester of pregnancy. Whenever there is a thin, frothy, profuse vaginal discharge, what is your diagnosis? Trichomoniasis. Whenever there is an intense pruritus, you call it as candidiasis. So what is the risk factor for hydatiform mole? A higher ratio of either maternal or paternal chromosomes, maternal to paternal chromosomes, higher ratio will lead to hydatiform mole. Once more, partial mole, complete mole. How do you differentiate? You need to read Babuji. What is the indication for chemotherapy for molar pregnancy? There is a scoring system to grade the molar pregnancy. Any WHO score more than 88. Hormones which are secreted by the fetal Leydig cell, always LT, LNT, Larsen turbo, Leydig cells testosterone. Now, what is the common site of tubal pregnancy? Ampulla. And longest survival of ectopic pregnancy is an interstitial pregnancy. Whenever ovarian ectopic pregnancy is there, you can do conservative surgery if diagnosed very early. So how does placental separation occur? Typically, it will occur through the deep spongy layer of the decidua bassalis. So you should know the decidua placenta, what are the layers, who contributes to each of those layers, everything you should be sure about the placenta. Vareva, खेलते हमने 187 single-liners को खत्म कर दिया. So, yes, Daljinder Singh says, sir, please zoom out. So, please go to the learnograph.com, doctor. Please go to www.learnograph.com. Here you have the sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Totally 10 books hai. 10 e-book PDFs. E-book PDFs में each PDF में 1000 PYQs and 10 e-books में you have 10,000 single liners PYQs, each classified into topic. Last moment में खाली topic list देख के भी आप टॉपर बन सकते हो एग्जाम में. सिंपल टॉपिक लिस्ट को एक मर्तबा एक नजर लगाओ, टॉपर बन जाओगे. All right. So every day, let me promise you, I'm a MD General Medicine, Critical Care and Intensive Care Chief of Army in TX Hospital Group in Hyderabad, right? Chief of Intensive Care. What we discuss on a good number of cases we see every day clinically, right? While preparing for entrance, we didn't see. So every day, even if I'm busy whole day, evening, I'll come online on the YouTube and conduct one interactive session, mainly to inspire you and also to make you to go back to the learnograph.com, download the ebook PDF and do the preparation. You just require 350 hours to become the topper. ABP is saying, sir, paper भी आप ही सेट करते हो और कंपटीशन भी आप ही बड़ा रहते हो. भैया, हम तो पेपर नहीं सेट कर रहे, हम तो लास्ट 25 इयर्स से 3 लाख स्टूडेंट्स को उनके साथ बैठ के उनका क्लासमेट, रूममेट, बेंचमेट, टेबलमेट बन के रोज उसको कैसे कम पढ़ना, अच्छा रैंक आना, क्या एग्जामिनर चाहता है, क्या पढ़ना है, ये फोकस देने वाला हम्बल अध्यापक हूं. आई एम ए टीचर, राइट? बट लेट मी टेल यू, the moment you do 10,000 PYQs, you already have known the map of the mind of the examiner. Once you know that, examiner should be your slave. We should not become the slave to the examiner doctor. So every day, please come online. I will come online on the YouTube. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे हमारा नंबर आ गया है, right? So I'm leaving you my personal WhatsApp number 9502119082. You can always WhatsApp me. कभी भी टेंशन आए, डाउट आए, क्या करना, क्या नहीं करना, I'm always available. Only if I'm with the patients, I'll take some time to come back and then answer you, right, doctor? So continuing our journey, positive amine test, Bigfoot test, bacterial vaginosis. Woodland bodies, where are they located in epidermis? Stratum granulosum. What is anagen, telogen? Anagen phase of the hair is the phase of activity and growth, which is the drug used for comedonal acne, retinoids. That's the reason whenever you are giving retinoids to a young woman, if she becomes pregnant, you need to be a little careful. So where do you do phototherapy? Psoriasis में करते हैं. Umbilicated vesicles after vaccination, eczema herpeticum. Epidermal nevus lines को कहते हैं Blaschkos lines. Seborrheic dermatitis, Pityrosporum ovale is the organism. Bullous pemphigoid में pruritus होता है. Psoriasis में we use Gokerman's regime, जिसमें ultraviolet B plus coal tar. Ultraviolet B plus coal tar is the combination. Psoriasis can lead to deforming arthritis. Arthritis deformans कहते हैं. इसमें oligoarticular, polyarticular, different varieties. Most common type is oligoarticular. Whenever buboes are there in a pregnant female, you can safely give erythromycin. Plaque is not a hemorrhagic lesion. Petechiae, purpurae, they're all hemorrhagic lesions. Macula cerulea, where do you see, doctor? Pediculosis hominis corporis. What is the most common site for atopic dermatitis? Typically in the popliteal fossa. Bull's eye-like skin lesions in erythema multiforme. Scabies in pregnancy, permethrin is a drug of choice. Solitary painless ulcer on genitalia. Painless is hard chancre, syphilitic chancre is what you need to remember. Lines of Blaschko represent the lines of embryonic development. Murky lines in the nails, where do we see? Nephrotic syndrome. This is one of the image-based question, doctor. You need to be very sure how murky lines look like, Bue's line look like, pitting of the nails look like. You need to be very sure. So there are 50 PDFs. Let me once more tell you, 50 PDF ebooks on 50 full-scale grand tests, doctor. Full-scale grand tests for the NEETPG on learnograph.com, right? So take an opportunity to download them, share with your friends freely, and then sit with your friends, discuss with your friends. A 50 PDF ebooks, full-scale mock test. Every mock test is followed by extensive mind map based, all mind maps of high-yield facts about that each of the MCQ is being given. एक अच्छा फ्रेंड मिल गया तो उनके साथ बैठ के ये 50 फुल स्केल ग्रैंड टेस्ट को रिवाइज करो, शांति से सीट मिल जाएगा, राइट? इसमें हमने ऑलमोस्ट 2000 इमेज बेस्ड क्वेश्चंस को दिया है मॉक टेस्ट के रूप में. So what is the drug which can lead to drug induced pemphigus? Penicillamine. Periungual desquamation in Kawasaki होता क्या? होता कब होता? Second to third week. What is the time for the flow from arm to tongue? 13 seconds. Type 1, type 2 respiratory failures you already know. Hypoxia with normocapnia is type 1 respiratory failure. Hypoxia with hypercapnia is type 2 respiratory failure. बीच में टाइप 3 क्या है भैया? Respiratory failure in post-operative patient is called type 3 respiratory failure. So what is the contraindication for LMA? Airway. It is pregnant female. Who is the first person to demonstrate the anesthesia? It is not a medical guy. It was a dental guy called W.T.G. Morton. If you go to Massachusetts, there is a ether dome where first time Morton has demonstrated. When Morton demonstrated, the surgeon called Bigelow. Bigelow was the name of the surgeon who operated the first case. Everybody thought it is a humbug. There's a beautiful story about Morton's first public demonstration of ether. So he is the one who used diethyl ether. Oxygen percentage in mouth-to-mouth respiration. What is the sweetest stage of life? The first kiss we do at 16th year. 16% is mouth-to-mouth respiration. अगर ये मालूम नहीं है तो एग्जामिनर डिप्रेस हो जाएगा. Circuit for ventilating spontaneously breathing infant is Jackson-Rees modification of Ayer's TPs. Once more, all these Mapleson systems, classification, you need to be very sure for the tomorrow's NEETPG doctor. Best uterine relaxing agent, halothane. Hepatotoxic anesthetist agent, halothane. Dissociative anesthesia seen with ketamine, which anesthetic sensitizes the myocardium to catecholamines leading to arrhythmias, halothane. The safe anesthetic agent in TICP is thiopentone. Which anesthetic is bronchodilator, very potent bronchodilator, which you can use it. Typically in asthma patients, ketamine. What is the parameter that tells the speed of induction and speed of recovery? Blood gas partition coefficient. So typically, if you give nitrous oxide, it will displace the oxygen, leading to hypoxia. What is that called as? Diffusion hypoxia is what you need to remember. हम बहुत खुश हैं 32 online classmates to tell 25-year-old teacher is still interesting for the students at midnight. Raj is saying, amazing session. Wow. Thank you, Raj, for the wonderful compliment. Let me tell you, teachers are highly vulnerable to the compliment. So don't forget to compliment the teacher. Teachers and parents, a lot of times we think, thank you, mom. Wow, my wonderful daddy, and hug him. We don't do that. But when you do that, a parent will feel so happy. Recently, you have seen, no? Daughter is a police officer, IAS officer. Daddy was a promotee superintendent of police. And he has saluted the daughter, who is an IAS officer. Like that, doctor, today you're all students dreaming to become toppers and top consultants. One day you will be cardiologist, cardiothoracic surgeon, neurologist, neurosurgeon. Then I will give a call. Hey Raj, hey Daljinder, this is the case, please look into it. He has got a subarachnoid hemorrhage. Will you operate? Yes, sir, definitely, we'll take care. Please send. So that time, as your old teacher, I will be very proud to say, hey, this top neurosurgeon, Daljinder, once upon a time was sitting at midnight, 12:15, preparing for entrance exam, and I had the privilege to do the revision for His Royal Highness, Daljinder. So, what is the landmark for the pudendal nerve block, doctor? Ischial tuberosity. If you do a lumbar puncture, there will be a headache, post-dural puncture headache. When will it start? 12 to 72 hours. What is the contraindication for the neuraxial block, clotting disorder? Once more, all the list of contraindications for the neuraxial block you need to remember. What is the long-acting local anesthetic? Dibucaine. Short-acting local anesthetic? Procaine. Maternal mortality. Spinal anesthesia, if you give a high block, there is very high chance. Lidocaine is associated with Cauda syndrome. Then what is the composition of the soda lime which is used for the absorption of the carbon dioxide in the anesthetic systems? 4% NaOH, 80% CaOH twice, and 1% KOH, and 15% moisture. Suxamidonium, how does it act? It acts on the sodium channels. The only available depolarizing muscle relaxant in the clinical practice is succinylcholine, otherwise suxamethonium. Neuromuscular blockage of the succinylcholine, how do you demonstrate that it is successful? Fade on tetanic stimulation. Typically it will fade on. So what are the 5 differences between depolarizing, non-depolarizing agents? You need to master it for the tomorrow's NEETPG. 1 MCQ surely will come. 1 CT scan of chest में 7 millis MSV is the amount of radiation. So similarly, X-ray में कितना होता है? Everything you should be sure. Whenever you give radiation therapy, what is the late severe adverse effect, doctor? Osteoradionecrosis. What will you use in PET scan? 18 fluoroglucose. 18, that is fluorine. 18 is the one which you use. What is IMRT? Intensity modulated radiation therapy, precisely directed high dose radiation that you give. Stereotactic radiosurgery, where will you use? We use it in AV malformations in the brain. Radioiodine से कौन सा रेडिएशन निकलेगा? अल्फा नहीं, बीटा and gamma. Tree in bud appearance on CT. Where do you see? Pulmonary TB. Once more, go back to the Google images. उसके लिए आपको कोई आके बैठ के डीवीडी सेशन का जरूरत नहीं है, गूगल इमेजेस में मिल जाएगा। पल्मोनरी टीबी 3 in बैक, फेवरेट क्वेश्चन टुमारो भी आएगा। लंग एब्सेस है तो यू विल डू CECT, because lung abscess is a globular opacity with a contrast enhancement surrounding it. Halo sign on CT definitely आने वाला MCQ है, once more image based. Invasive pulmonary aspergillosis में होता है। Sarcoidosis में what do you see, doctor? Potato nodes, bilateral hilar lymphadenopathy is the characteristic feature of sarcoidosis. Very good. 15 more students have just now downloaded the present sprint and also the whole series of sprint. Almost 7, 8, 9, 10 also is being purchased by a group of students. Very good. So once you download the PDF, there is no need of expiry date or plan A, plan X, plan D. Nothing is needed. You have it. You can share it with as many friends as you can, and you can sit together and do the discussion by yourself by meeting on a Zoom meeting. That's the best and most effective way. So the role of the teacher is only to give you the correct study material, doctor. Right? The role of the teacher is not to teach. It is to give you the right material in your own hand. No need of fearing that somebody is looking that you are copying, somebody is preventing you from your access to the subscription. All that is bakwas. There's a PDF available. Pay $300, download the PDF, share with another 300 of your friends, sit together on a Zoom call. One of you initiate the discussion, fatafat revision kar lo. That is the best way. And Dr. Murli Bharadwaj is available every day to give you the initiation for you. Perforated peptic ulcer, there will be air under the diaphragm. Whenever there's a trauma with a left upper quadrant pain, you need to do the CT scan of abdomen. Once upon a time, they used to do lot of splenectomies whenever there is any trauma. But later, advanced CT, good imaging, made them to identify the degree of tear in the spleen and accordingly manage conservatively for grade 1 and grade 2 splenic trauma. Ring enhancing lesion is toxoplasmosis. Low attenuation lesion on CT is lipoma. Chilaiditi syndrome में pseudo pneumoperitoneum will be seen. Just go back. Ask the Google what is meant by Chilaiditi syndrome. It's much better when you ask and learn it rather than I telling or any teacher telling. Which agent you use to measure GFR, doctor? Technetium 99M DTPA is what you should remember. Cobra head appearance. This is one of the favorite question, doctor. Whenever there is any ureterocele, when you pass the contrast, cobra head appearance. But cobra will be like this. But there the cobra won't be like that. The cobra will be like this. आप जाके गूगल इमेज में कोबरा हेड अपीयरेंस यूरेट्रोसील बोल के मारो, आपको मिल जाएगा. ठीक है? But it's a favorite question of the examiner. If you don't know, examiner will think ये क्या है, इंग्लैंड को आया मगर इंग्लिश नहीं आता है. Right? इंग्लैंड को गए तो इंग्लिश आना है. Now, doctor, gastric volvulus typically will appear on CT like an enlarged twisted stomach. Go back to the Google and then look how it looks like. Intracranial hemorrhage, less than 48 hours. Investigation of choice is a CT. Epidural hematoma will be biconvex hyperdense lesion, biconvex. Whereas crescentic, Chandni ke jaise, crescentic moon is the feature of subdural hematoma. Acute subarachnoid hemorrhage hai to. What is the investigation, doctor? Remember, if you look at the CT, Normally, sylvian fissures will not be filled with anything. But if they are filled with some opacity, means there is a blood between pyometer and arachnoid, that is the subarachnoid space. So, how to recognize on imaging subarachnoid hemorrhage? By finding the opacity in the sylvian fissures. Favorite question of the examiner. Right, doctor? Now, sausage finger appearance, psoriatic arthritis. Whenever patellofemoral problem is there, skyline view X-ray is used. Optic neuritis के लिए MRI brain and orbit. So today, once more, go to MRI brain and orbit optic neuritis in Google. You will find images. Soft tissue sarcoma identified by MRI. Go through the Google images. Tigroid appearance pattern on MRI, metachromatic leukodystrophy. Who gave theory of human motivation? Dr. Murali Bharadwaj. Abraham Maslow is what you need to remember. भैया illusion क्या होता है? Abnormal perception by a sensory misinterpretation of the actual stimulus. एक रोप है, रोप को रोप नहीं फील हुआ, सांप बोल के फील हुआ. You felt rope as a snake is an example of abnormal perception by a sensory misinterpretation when there is an actual stimulus is called illusion. रोप भी नहीं है, सांप भी नहीं है, मगर आपको सांप दिख रहा है. Without sensory, without any stimulus, then that is hallucination is what you need to remember. Now, whenever paraphilias are there, what is the best medical treatment? SSRI. So, one of my patient about a couple of days ago, he's addicted to pornography. He's a graduate and working in Amazon. Sir, he was telling that Dr. Saab, almost 7-8 times he does the masturbation. So when that obsession of masturbation and pornography comes, if it comes once in a day, it's okay. But 8 times is too much. It is like seminoria, like a diarrhea and rhinorrhea, right? So SSRIs are the treatment. SSRIs are the treatment. Suspicion of infidelity. Suspicion of infidelity is a delusional disorder. So once more, what is meant by Othello's, Capgras syndrome? All these delusional disorders, you should be good. A belief of decreasing size of the penis is also, it's called Dhat syndrome, DHAT. Dhat syndrome is a delusional disorder. What is the most common substance of abuse in India? Tobacco. In neuroleptic malignant syndrome, the cause of death is respiratory failure. Whereas a lesion in Korsakoff syndrome, mammillary body, which is nearer to the midbrain, is what you need to remember. Sex reassignment surgery, where will you do? Gender identity disorder. Whatever. Can I believe this? At 12:30 early morning, at 12:30 early morning, 33 online classmates, अरे खुश हुआ मोगैम्बो, हम बहुत. That shows that how much you are determined. We fight on the land, we fight on the water, we fight on the air, but win the world war, said Winston Churchill. Like that. In life, there are few situations in life where sheer audacity and an iron fist of willpower will only make you to become the winner with perseverance and a single dream and realization oneself that you are going to be the topper. PG entrance is one such thing, doctor. Let me tell you, right? Not only you, we all passed through the same phase. Not now, 25 years ago when we became toppers. It is the same situation. Manish saying, sir, you are looking energetic. Yes. You are like 100 kgs of marijuana, cannabis, sitting with you and studying. Some of you must be 25, 26, right? Where my first child was born when I was in my final year of MBBS, I produced my first child. I became a father-in-law by the time I was 48. So when we meet wonderful young guys like you who are determined to become great. See, today I have a patient with cerebral stroke. I have a patient who had urosepsis, and I have a patient who is in type 2 respiratory failure on non-invasive ventilation, whom I admitted all of them, who is managing a 28, 30-year-old younger guy like you is managing. I'm only deciding treatment at the start of the day. By इसको वेंटिलेट करेंगे या नहीं करेंगे, इसको मेरापिराम स्टार्ट करेंगे, सेफ्टेजिडिम स्टार्ट करेंगे, टाजोबैक्टम स्टार्ट करेंगे, पाइपरएसिलिन स्टार्ट करेंगे, क्या करेंगे, इसको एमआरआई करेंगे या नहीं करेंगे. That's all. But who has the energy to drive, save the patients on my behalf the whole night? Young people like you. So that is the reason meeting you all will bring energy to me. You are like my cannabis, you are like my cocaine to give the energy, doctor, right? So now, that's the reason what I'm telling you is, the more जोश में अगर पढ़ाई करे तो आपको याद अच्छा रहेगा, आप एग्जाम हॉल में भी बेटर परफॉर्म करके आओगे. Don't get succumbed to unnecessary guilt, unnecessary worry, unnecessary tension, right? You are much, much brilliant than this stupid exam called NEETPG. What is the non-reversible cause of dementia? Alzheimer's. Once more, cortical, subcortical dementia. What are the differences you need to read for the last moment exam? Then, Kabebi, dementia versus delirium. There are 5 differences between the two. Dementia may consciousness is not altered. Delirium may there is a state of altered consciousness is what you need to remember. The patient has bad behavior right from the childhood. It's a personality disorder called antisocial. So what is borderline personality? What is narcissistic personality? What is dependent personality? What is schizoid personality? Antisocial personality? All kinds of personalities. You need to be 100% sure for the tomorrow's exam, doctor. Compulsive eating of the hair is called trichophagia. What is the most common cause of delirium, doctor? Always infection. Whenever your patient is lying down with delirium, hopping around, you need to do typically look for any underlying infection like urinary tract infection, pneumonias, anything can produce. The delirium is what you need to Ritvika Dagar is saying, sir, we know we are much better than exam NEETPG, but who will tell our parents? Good point, right? Your results will tell Ritvika to mama, dada, everybody that you are brilliant. You know, after all, you are created. वो जनक है आपका, है ना? So they know very well. They won't appreciate on the face of us. They will always be apprehensive, right? So tomorrow when you go for the NEETPG on Sunday, I'll be waiting like your old parent. बच्चे लोग क्या लिखा है एग्जाम में, क्या आया है, हाइपरकेली में आया होगा, हाइपोकैल्सी में आया होगा, सार्कोइडोसिस आया होगा, बच्ची कैसे लिख रहे. So we'll be waiting anxiously. The moment you come out of exam hall, I know you will tell, sir, उस रात, उस आफ्टरनून, उस इवनिंग हम जो स्प्रिंट पीडीएफ में डिस्कस किए हैं, वही पॉइंट्स आया है, right? So that's the reason winning is a cakewalk, doctor. Just enjoy the ride, right? Just enjoy the ride. That's what you need to do. Completely relaxed. Those who are more relaxed are going to be the bigger winners. You should remember. Now, Capgras syndrome, delusion of double, not double answer. ए भी अच्छा लग रहा है, बी आंसर बी भी वही लग रहा है, उसको कैपग्रास नहीं बोलते भाई, उसको बोलते हैं लूजर सिंड्रोम. डेल्यूशन ऑफ डबल बोले तो रामू भीमू, रोजा सरोजा, गीता सीता आर लुकिंग द सेम. Maybe Gita replaced in the body of Sita. If you are feeling like that, it's called Capgras. Jamaismo is the feeling of strangeness to the familiar situation. What is the meaning of that? NEETPG 2023 में भी यही क्वेश्चन आया, 2022 में भी क्वेश्चन आया, अभी भी आया, मगर आंसर मुझे मालूम नहीं है. Feeling of strangeness of a familiar situation called NEETPG is Jamaismo. So please don't carry that. Now, catatonic schizophrenia, there is a waxy flexibility, increased psychomotor activity. Then what is the characteristic hallucination of schizophrenia, doctor? Auditory hallucination, giving the running commentary. What is the running commentary? Ramu, you are going to kill your neighbor. Ramu, police are following you. Ramu, you are not going to get in NEETPG. अगर वो सुनाई दे रहे तो वो schizophrenia है. What is the good prognostic factor of schizophrenia? Depression. Self-mutilation is a feature of von Gogh syndrome. Inventing new words. What is that called? Neologisms is the feature of schizophrenia, is what you need to remember. Increased dopamine levels. Always increased dopamine lead to psychosis. Decreased dopamine lead to echinacea, rigidity, tremor, and Parkinsonism is what you need to remember. Loosening of association is an example of formal thought disorder. Formal thought disorder. Then, where do you see visual? What do you see in alcoholism? Visual hallucination. Yamadharmaraj dikhayega. Visual hallucination. Menaka, Rambha, Tilottama dance करते हुए दिखाएगा अल्कोहलिज्म में. मगर यमधर्मराज आपके कानों में बात कर रहा है. Auditory hallucination with a running commentary. That is schizophrenia. Be very sure. So what is the treatment of choice for acute panic attack? Benzodiazepines. Where do you get gamma waves? Typically, gamma waves of REM sleep comes when there is an intense attention. Agoraphobia, fear for heights. Behavioral therapy, it is an indication. What is the main difference between anorexia and bulimia? Bulimia versus anorexia, it is the weight. Bulimia nervosa is a eating disorder with a normal weight, and anorexia is a weight loss. Binge eating disorder will lead to obesity. Opioid withdrawal में goose flesh होता है. All features of the opioid withdrawal, substance abuse disorders you should know. Phototherapy, where do we use? Seasonal affective disorder में winter आते ही depression आ गया तो seasonal affective. Affect means mood. Seasonal affective disorder. Sad में phototherapy. Flight of ideas is the characteristic feature of mania. Chronic multiple tic disorder is Tourette syndrome. Conventional drug for delirium, whenever your patient is having delirium, is haloperidol. Haloperidol. Right? Serenase. Serenase is the common brand name, doctor. General paralysis of insane. Typically, where do you see? Neurosyphilis. Neurosyphilis में some of the top mafia Italian dons in America ultimately are lying down with nothing, remembering that they are the dons, because syphilis led to vasculitis, leading to general paralysis of insane in tertiary syphilis. Oppositionalism in a young child. तू कौन होता रे मुझे बोलने वाले? टीचर को बोलता है तू कौन है रे मुझे बोलने वाले. वो oppositionalism in a young child is because of the mental distress. Narcolepsy में what is the drug that you use? Modafinil. Modafinil is used in narcolepsy. So what is narcolepsy? Sudden intrusion of the REM without any precedence of NREM lead to hypotonic episode where the person falls into sleep suddenly. That's called narcolepsy, where modafinil is the drug of choice. Imipramine, tricyclic antidepressant, it has no mood stabilizing property. So you should know what are the drugs used for stabilization of the mood. Whenever haloperidol causes extrapyramidal side effect, how do you treat it? By giving anticholinergic drug like trihexyphenidyl. Always remember, doctor, dopamine and acetylcholine, they both need to be balanced well. Any decrease in dopamine will cause a relative excess of acetylcholine. So if you are giving haloperidol, what are you doing? You are decreasing the dopamine level. Because of that, relative excess of acetylcholine ho gaya, which will be responsible for the extrapyramidal side effects like rigidity, akinesia, tremor, especially tremor. So you need to give anticholinergic drug to counter that. What is the most common complication if you are giving electroconvulsive therapy, doctor? Amnesia. Once more, what are the indications, contraindications for electroconvulsive therapy? You should know. So, doctor, we finished almost 300 PYQs. कितना देर लगा हमको? 1 hour 45 minutes. इसमें 15 मिनट गप्पा मारने के लिए छोड़ो, पेप टॉक. 1.5 hour तो हम सचमुच पढ़ाई किया. सो फ्रेंड्स के साथ बैठे तो 10 घंटे बैठना, 3 घंटे गप्पा मारना, 7 घंटे असल में पढ़ना. राइट? सो 300 PYQs we finished in no time of 1.5 hour. That means it takes not more than 5-6 hours to run one round of these 1000 PYQs. Imagine 70-60 hours में आप you can finish all 10,000 PYQs. Mark my word. Suddenly you will realize instead of 120 questions correctly answered, you will answer 160 correctly and go to government medical college. Still 3 days, 72 hours is available for you. Race it, doctor. And tomorrow morning, once more, I am going to be there. Don't forget to like this video on YouTube. Go to after the video is over, go to the comments. Right? Please write your comments. Good comments, bad comments, any comment is okay, but write comment. Then YouTube will feel inquisitive. What is this guy midnight doing? And then it will try to make it viral. Right? So thank you so much. Be happy. Don't worry. I think you know that song, right? Listen it, enjoy. We are already medical students here, and we are 2 standard deviations superior to the remaining race in the country among your same age. Remember that. Good night, and we will all see you tomorrow.